Ladies and gentlemen, welcome back to the Ultimate Channel CK with me, Dr. Lewis Muchile. And again, today is an exciting video, and I'm going to at least shed some light about chemotherapy. Chemotherapy is supposed to mean drug treatment for cancer, okay? But chemotherapy is a word that is used widely. To some extent, antibiotics are also chemotherapy, because this is the use of drugs to selectively inhibit growth of a specific microbe without or with causing less harm to the host cells. So chemotherapy has utilized the same concept to create drugs that only target the cancer cell and with minimal or no effect on the host cells. But we have our own doubts also. So I pose a question to you. Do cancer drugs cause more harm than they help? We'll find out. So, people have tried to define cancer in different ways, but there's no absolute definition that describes cancer the way it is. People have tried to use genetic mutations. People have tried to use abnormal multiplication of cells, and all these definitions around cancer. But nobody has come out with, not even research has come up with an appropriate way that cancer can be defined, and that makes it so hard to even handle it, because once you know the cause and once you can define the cause, then you can treat the disease or the condition. So there are three ways in which you treat cancer. The first way is radiation. Radiation is where you use rays to suppress the growth of that cell or that mass of cells. Then once you suppress their growth, you go to the next stage, which is called surgery or surgical removal of that mass. Okay, then now after that, you can also use drugs, which is chemotherapy. So there are three ways: chemotherapy, radiation, and surgery. So chemotherapy and radiation are supposed to, if at all it's a lump, a tumor, you use these drugs or this radiation to suppress the multiplication of these cells of that tumor so that it doesn't spread. And then, now, you can use surgical removal to get the mass off, and then continue with drugs to suppress the cells and the immunity more. Now, so those are the three approaches in management or treatment of cancer. Now, what causes cancer? Cancer is caused by multifactors. It's a multifactorial kind of condition. So straight from diets and radiation, and there's so many causes of cancer that if we start talking about, we can talk about the whole day. So I picked a small portion of the entire cancer, which is the chemotherapy, the management using drugs, and decided to talk about it. So these cancer drugs, they are among the most toxic drugs we've ever known. Okay, so there's like 7 to 8 major side effects of cancer drugs that I'll explain as we go by. Side effect number 1. Then after explaining these side effects, then we will conclude and know if at all they cause more help or more harm, if at all chemotherapy is useful or is harmful in quotes. So number 1, they cause cancer. If at all you've had a relative who has had cancer, or even yourself, and you visit a cancer center and you see how these drugs, you have a chance to see how these drugs, even medics, how they mix or how they prepare these drugs, you'll even wonder if these drugs are going to be input in a human body, because all the protective gear they put on into the chamber, how they prepare it, they are avoiding contact with these drugs because these drugs are carcinogenic, so they cause cancer. So introducing a drug that causes cancer to treat cancer, I don't see the benefits. And again, I'm not disputing cancer drugs have been of help, but I'm just pointing out the gaps. So they cause cancer. They irritate the skin, they cause skin cancer, they can cause abnormal multiplication of cells, they can induce mutation in your cells, and therefore you're treating one cancer and coming up with another cancer. Number 2, bleeding of gums and ulcers. Now remember, these drugs are targeting actively multiplying cells, and the cells that are lining the mouth and the gut are also actively and fast multiplying. And that's why when you burn your mouth with maybe a cup of tea, within a few minutes it's already healing, because the cells are multiplying faster. So these cancer drugs use this fast multiplication of cells and proliferation of cells as a chance to terminate them, okay? Because some of them act on the DNA and they terminate that. So now, this affects the gums and the GIT, so you'll have all these ulcerations in your stomach, all the way to the throat and the mouth. So if you've seen cancer patients on the drugs, you will see bleeding gums and also mouth ulceration and the tongue. Number 3, nausea and vomiting. Most cancer patients on chemotherapy, they are given a drug called ondansetron, and this drug is one that inhibits vomiting. So even some of them will come to the clinic or to their cancer clinics and tell you to prepare their drug for vomiting earlier, because they know once these drugs get into the system, they induce vomiting and nausea. And therefore, some nutrients and some ions like potassium will be lost when these patients are vomiting, and that will cause heart problems. So that is more danger also. Number 4, we have alopecia. Alopecia is the loss of hair. So these patients will lose their hair. Most of them will become bald. Some will lose their body hairs, and even their skins become rough and scaly. So yeah, the effects on that. And again, this is because of rapidly multiplying cells. So alopecia. Number 5, we have infertility and libido, and therefore these cells, remember again we said they target rapidly multiplying cells. Sperm cells and the ova are also rapidly multiplying, so they will induce infertility and low libido in both men and female. Now, if you're young and you get cancer and you're taken to maybe a specialist and you're told to start chemotherapy, you're warned about these side effects. So it's not like something that you'll just experience from the blues. You'll be warned about them so that you get to understand when these effects happen, you know. So, number 6, we have bone marrow suppression. Bone marrow suppression, still, these are the cells that are rapidly multiplying. So cancer drugs target these cells, they inhibit them, and once you inhibit bone marrow multiplication, that means you alter production of red blood cells, and that means future anemia. So these patients will go through a chemotherapy session, but come out with anemia. Then, the last one is loss of brain and nerve function. So you'll have this numbness, you'll have fogging, mental fogging, and loss of memory. And all this is because of the effects of those chemotherapy drugs. So, back to our question. Do you think cancer drugs cause more harm than help? Well, that's up to you to decide. But just keep in mind that all these are proven and proven side effects of cancer medication, and you should be cautious of this. So, focus on prevention rather than cure. And we keep talking about healthy diets here for the cells, healthy diets for your body. So focus on that so that you can avoid future cancer. And this comes from insulin resistance. For those who remember, this comes from insulin resistance. And therefore, if you avoid insulin resistance, then all this will not happen. So thank you for watching. I'll see you again next.